Good evening. Thank you, Hani. Thank you, everyone. I would like to speak about what's happening now in Gaza Strip and also what is possible to do as solidarity actions. First, I would like to describe the situation before, how it was before October 7th. As you know, Gaza Strip since 17 years is a prison in which 300,000 people live as a prison, and it's under blockade. We cannot go out, enter. It's a whole generation of young people from 2006 till 2023 who were born and grew during this situation, and also attacks, not only blockades, especially from 2008 till 2023, especially 2008, 9, 11, 14, 19, 21, there was attacks. And now currently, the current war from October. So we're speaking about a whole generation since 17 years who lived during such hard times, war in the Gaza Strip. The Gaza Strip is there are seven checkpoints to enter and go out, and are for the trucks, the camions, the food trucks enter from there. There are a couple of checkpoints for people. And since 2001, there is only one checkpoint working, open, which is Rafah checkpoint to Egypt. This is for people who can enter and go from there, and no food trucks. No trucks. There's also Salah ad-Din portal checkpoint. It's a checkpoint between Gaza Strip and occupied Palestine, which is Israel. This is a closed um, checkpoint, and it opens only for tanks, military tanks, and military and attacks on Gaza Strip. If we want to follow the situation from the previous wars, this was the worst. The worst war was in 2014, in which, as the inhabitant described, it was the worst war. 11,000 buildings were destroyed, and tens of thousands of people were expelled from from their houses. Schools were destroyed. And after this, the tentative of rebuilding, there was a deal between the West and the US to rebuild these these buildings, but yet it was supposed to finish, this rebuilding operation was supposed to finish 2 months before October, this October. And some of the buildings were finished already. So the main components of life in Gaza Strip was very, very difficult in the Gaza Strip, and many reports special reports from the local committees who work in the Gaza Strip, where including the UN committees at the UN, UNICEF, etc., describe the situation as disastrous. So in this context, we have a new war as a genocide. Its main titles is to submit the civilians in the Gaza Strip and and in which everything is allowed, including bombing hospitals. So since 35 days, uh, all equipment, social and sanitary equipment, health equipment are being destroyed systematically, as was announced in the government of Israel, the government of occupation. They want to revenge. This is a revenge from them. And so they destroyed also schools. More than 60 schools were destroyed. More than 30 health buildings were destroyed, or and more than 195 doctor or health workers were targeted, as well as ambulances who were circulating, going to the hospitals, or through Rafah checkpoint. The Red Cross also. So the situation is disastrous. And they are also using new bombs, US fabrication, as the one that used against the hospital Shifa, which is called Shafra. So it's a silent bomb. You can't hear it, and it doesn't have no smoke either. So we can't hear it, we can't see it. And it's a deadly bomb called Shafra, and it amputates, it cuts the arms and legs of people. People didn't know about this weapon. They only hear victims screaming. And also, as you know, all the precedent wars, there used to be a moment in which there a ceasefire for a limited period of time, days or weeks, so that the relief groups can enter and help, and then the bombing would continue. But now Israel is completely refusing a ceasefire, a humanitarian ceasefire, and they are continuing their bombing. And many colleagues are saying that this war is being piloted by the US. And what was the ceasefire, the humanitarian ceasefire they spoke about in the latest day were not ceasefires. Israel is entering in the north of the Gaza Strip, and they are expelling people, making them, obliging them to move from this zone. Well, all this is being done as in Nasser neighborhood, where Gaza city, and Shifa Health Complex, in which the main specialists, health specialists and doctors work there. There's a special building for chirurgical operations. And there is also a Nasser neighborhood in the center of Gaza city. There are four hospitals that are specialized in children, and also cancer hospital and Aude hospital in Jabalia camps. So Jabalia Hospital is the center of health services in there. So what's happening now is that Israel is trying to uh, publish to fake news, saying that these hospitals are military hospitals or military buildings, and in parallel, the Office of the United Nations is asking for an international investigation, to send independent employees to check and to check if this information was correct or not, and Israel refused that. There are also in the last 2 days, a new information, a new information that Israel is targeting hospitals. So in parallel, movements of solidarities are being and thousands of people in Gaza and in the north of the Gaza Strip go to the hospitals because they consider they would be a safe place according to international law. So they hid there. Thousands of people, of civilians whose houses were destroyed, went and hid in the hospitals, for including the Shifa hospital, as they thought it would be a safe place for them. And after this huge pressure from Israel and the bombing of Shifa, so there are now new migrant civilians that are going from there. And at the same time, the using of phosphoric bombs. So this is a revenge, a ferocious revenge against Gaza Strip, especially the north region, until they announce that have controlled, that Israel controls all this region, the North Strip, as well as Gaza City. In parallel, the leaders of the West gave their solidarity to Israel. So now we have more than 68%. We have we have numbers that more than 60% of the victims are civilians and children. The civilians and children are being targeted, and also the shops, the food shops. And Israel is throwing tracts and letter messages to the population, asking them, telling them to go to the south and to leave this zone, saying they will cease fire for a while. So these are tactic ceasefires. They are bombing the food shops where people go and buy bread and food. And I am one of the people who were born in historic Palestine, which is the current Israel. All my family, we were born there. We come from there. I grew there, and we lost many of our relatives there. So these, it was a region of markets, popular markets, which are now being bombed, as well as hospitals. And also the health workers also lost the families, members of their families, and they have members of their family that they don't know anything about them. So in this awful situation, we are grateful for your solidarity. I think that what can be done, the first step is to ask for ceasefire, cease the genocide. Because otherwise it won't be possible to get help to the civilians. Could you please speak about the situation in the other regions of occupied Palestine? Yes, I will speak. I have only 4 minutes. So I will speak about that. Gaza Strip is not separated from what's happening in Cisjordania, West Bank. We are in West Bank. More than 170 victims who died in the camps in the West Bank, without them participating in any confrontation or any resistance against Israel. They were killed. Uh, Settlers were killed them, or Israeli soldiers. As in parallel, more than 20,000 settlers were militarized. They received weapons. And so it became very easy that any settler could own a weapon and threat or kill any Palestinian. and many Palestinians in their village could not leave their village. They could not circulate freely. As you know, we have the period of olive picking, which is very important economically for us in the West Bank. So people could not go to their land and pick olive. They are being targeted and even killed as they try to go to their land or circulate, including women, including children. And also it's very complicated to circulate, to move. And there are more than 2,800 detainees, Palestinians. So Palestinians are under a huge pressure, whether in the Gaza Strip or whether in the West Bank, under a huge pressure. Even artists, writers who wrote on their social media page like Facebook. Dalal Abu Hani, for example, a Palestinian artist, she wrote in solidarity with Palestine, and she was threatened. She was detained. So it's arbitrary detention without any judgment. So this is a terrorism, intellectual terrorism. So as well as intellectual terrorism in the world. For example, as you know, the case of Dr. Ghassan, who's in medical since Doctor Since Without Front Borders, who spoke about civilians, women, and children who hid in the hospital under attack. So Dr. Ghassan is in London and he has a Britannic citizenship. So his family in London, as well as him, were questioned and arrested and under interrogation about when did they go to Palestine and how did they get the UK visa, etc. So all this, whether Israel genocide, terrorism, I will try to conclude my words. We ask our friends and colleagues, and I'm grateful for your support and solidarity in favor of justice. We ask for a ceasefire. We would like to raise our voice asking for a ceasefire in the Gaza Strip, ceasefire of the genocide, and stop bombing the hospitals. So any intent of helping and sending humanitarian convoys it won't work without a ceasefire. As you know, many food trucks and humanitarian trucks that were trying to enter from Rafah checkpoint were bombed and targeted. So it would be very difficult to distribute the help, the aid. and very difficult for the international organization like the UN to enter and distribute um, the humanitarian aid to the civilians, and so that the hospitals can continue work operating, especially that tens of children, newborn children, are threatened of death anytime, and tens of people working in dialysis in hospital can die at any moment, and we have many critical cases who need to be saved. So this is why it's very important a ceasefire, to have a ceasefire. There are more than 1,400 who are under, we don't know about them. And also, so a ceasefire is the highest priority, as well as opening Rafah checkpoint, which is the only connection between Gaza Strip and the Arab region. So it's very important for it to be open. During the last 17 years before this October war, each day there was 500 trucks entering and exiting from this checkpoint. And as you know, more than 85% of the inhabitants of the Gaza Strips are refugees, and they live by this help, this humanitarian aid. So if the Rafah checkpoint is opened, the trucks, there will be 500 trucks that could enter the Gaza Strip. There was a daily 500 trucks entering Gaza Strip. Reports from international ONGs say that they need to send also the essentials of medical aid. And they say also that these trucks take a long time through passing through bureaucratic. Um, they need to pass by the Israeli bureaucracy, which is very complicated, and they are being registered and filtered. They would be registered and they would stay in a 50-kilometer stopped and being registered. So all this complicates very much the aid to enter Gaza Strip and to arrive to the civilians who need it. There it's very complicated to save injured civilian. We have more than 50 pregnant women in the Gaza Strip, uh, as well as a similar number who are expected to give birth at the end of the month. Well, in addition to this, hospitals are operating under bombing and all the entrances to the surgical rooms. There is a constant bombing during the day, every day.
Abed, can you hear me? Yes. I wonder if we could open it for discussion because there are some questions that have come from the people who are listening to this presentation. And I also would like Deepika to put everybody on the panel so we can see everybody. I know. Thank you. Thank you. This is very important for us, especially your demands, because that helps us with our solidarity. Now I want to open it up to the questions that people have. So I need for Deepika to allow. Okay. Good. Okay, she's putting everybody forward.
Yeah, I'm doing it now.
I know you are. I'm going to call on Dr. Fosia Khan from the Gaza Surgical Group, the health workers who are dedicated to support in Gaza, as he has a direct question for you. And then secondly, I would like to call on Anna, who raised the question, and pretty soon everybody will be on here. Okay, is Dr. Fosia available, Deepika?
I've put Anna already, and Fozia is also here now.
Okay, put everybody on. Dr. Fosia, please go ahead. Was that being translated?
Yes, it seems it was.
Okay, so I think that part of the answer, Fosia, is until there's a ceasefire, there's not going to be any way that other international people will be able to go into Gaza. So our first demand has to be that. But the idea would be that in the future, there be delegations and people like your organization that can come and give help to Gaza. So it's to be on the readiness, to be in readiness for when that takes place. But I would like Aved to make a comment if he wishes to. Are you there, Aved?
Unfortunately,
I agree with you, but the most important thing is to cease fire immediately. Even if the aid entered this Gaza Strip, albeit very important, and I understand the need that Dr. Fouzia is suggesting, especially with the high demand for medical aid, but we are in front of a tragic fact in Gaza. The hospitals The hospitals that are waiting for these aids are already under bombardment and under attack. The medical vehicles, the supply centers, the medical equipment are all under bombardment. So it won't be useful. This is what I think. It won't be useful to get these aids into the Strip, into the Gaza Strip, without stopping the aggression against these facilities and health centers. It's astounding. It's astounding to me for hospitals to be targets of military aggression. So ceasing fire is is paramount. It's the utmost goal for us now, in order for us to be able to get these aids inside the Gaza Strip. So we have to raise our voices everywhere, so that this won't be a tool for blackmail, whether military blackmail or political, to use women and children under death at every moment, to be used to blackmail. This shouldn't be a matter of blackmail for the Israeli occupation. We face a very, very difficult situation. This is unprecedented in all wars that we witnessed in our lives. I join my voice to Dr. Fawzia to raise the voice to get these aids inside the Gaza Strip, but we need our voice to reach European and American governments to stop this war. There is no 1 centimeter in Gaza Strip where people can take refuge. What is being said about having safe areas in Gaza Strip is false. Around 46% of Palestinians killed were in the middle and the south of Gaza Strip. These areas were announced by the international community as safe areas, which is not true.
Yes. Thank you, Abed. I would like to say that we are doing international solidarity with Palestine, and maybe Anna can share some of the actions that are taking place in Europe today. Would you do that, Anna?
Yes, sure. Hi, everyone. Hi, Abed. Essentially, I don't want to make this about Europe, but for the last couple of weeks, we have seen actually growing mobilizations in solidarity with Palestine. Although we know that many people have been subjected to repression because of that, some countries have really cracked down on what kind of protests are being allowed and which ones are not. Especially in Germany and France, people have been under severe pressure because of their organizing. We know that also in other countries, which maybe have not taken such an openly repressive stance, people have been called out in the media and vilified in the media a lot. Now, this is not stopping the organizing, so maybe just to point out a couple of examples from the last few days that I think are quite remarkable. One of the things that we are seeing is solidarity by the trade unions. Some trade unions in Italy, in Greece, have already stopped. So they have refused to work on ships which are transporting arms to Israel. So there is hope that this kind of initiative will spread throughout other ports as well. In addition to that, the students' movements have also taken action. There are a couple of universities in Italy where students have occupied their schools, their colleges, in solidarity with Palestine. Hopefully that will continue as well. But of course, I think that the main problem remains how able we are to shift the actual policies that are being developed at the level of the governments and of the European Union, which are, well, shameful. There's no other word for that. I would say that movements, and including PHM circles in Europe, are actually quite trying to do that on a local level. It is just that I don't think that kind of voice is still being heard as adamantly as it should be. It remains to be seen if it's going to happen at all. But yes, I don't think that will stop the organizing, and I actually think that even in some places which maybe historically have had less powerful movements, solidarity movements with Palestine, the issue is now being raised on a different level. So people are getting more informed of what's going on. Also, there is a certain shift in the discourse. If we compare it, I would say, to the first days of October, when the predominant discourse in Europe was one of support to Israel. People are now more critical about that, and more people are essentially saying that what is happening is genocide and that it should be called that way, and that Europe has that it has a responsibility to act. But maybe for more, I think it would maybe make sense if we shared the articles through email. I see that Deepika has also linked something in the chat here regarding the trade unions. So maybe have a look at that. But Maria, if I can, I was just wondering if I can ask Abed, because it's something that we haven't heard from before, like specifically, and I think it's a very important that it's an important thing to talk about. So about the condition in which the health workers find themselves right now, what kind of what kind of morale is there, what kind of support is there available, because working in those conditions, I'm sure it's not something really feasible.
I will talk about the morale, what we hear through contacting our colleagues and friends working in health centers and hospitals. You can imagine the health workers working under tragic conditions. Their lives and the lives of their families are threatened. As you know, the bombardment never stopped, not for 1 minute, in all the Gaza Strip. More than 35,000 bombs and rockets per hour. All of the health workers are working under high pressure with very, very limited equipment and capabilities. We heard about people working in hospitals, especially Al Shifa Hospital in Gaza City, are highly frustrated because of the silence, the international silence about what's happening in hospitals, especially in the last 3 days, where targeted aggression was happened on hospitals, including the Al-Shifa hospital. Most parts of the emergency department was damaged, and the newborn children department, one of the buildings in Al-Shifa hospitals, was targeted, including the solar panels, which give energy to the hospital, including the dialysis equipment. Al-Quds hospital also has been targeted, and the Red Crescent. Children hospitals are being targeted too, and many of the hospitals are out of service now, including the only ophthalmology hospital in Gaza. So many of the doctors, nurses, and health workers are working under high pressure. Many of them hasn't met their families in weeks. Part of them, unfortunately, opted to move with their families to the south because of the situation. The remaining staff are in high risk of death at any moment. Under direct threats of killing. Hospitals are being targeted by rockets, bombs. So they are under very difficult conditions. Many patients are lying down in the corridors of hospitals because of overcrowding. They don't have enough equipment in the EU. Doctors are working with very basic and even primitive methodologies to manage with what they have. They can't even move from one building to another in the same hospital, like what happened yesterday. We are in a hysterical situation of killing driven by rage, revenge, which is affecting the morale and the psychological situation of all health workers in Gaza Strip.
Thank you, Abed. I just want you to know that the people here on this webinar are all people who are supportive of you and can carry your message to their constituencies in different parts of the world. I wanted to say too that if people don't know, there's a huge surge of solidarity actions with Palestine in the United States in such a way that people are being criminalized for their protests in favor of the Palestinian people. The Jewish Voices for Peace went onto the Statue of Liberty and took over the Statue of Liberty the other day. That's a pretty amazing thing to do. They have at least 10,000 visitors each day at that place. And all over the United States, there are solidarity actions. Even today, there are solidarity actions taking place. So thank you, Anna, for putting that in there so people can see. And we'll try to put up some more information on the People's Health Movement website about solidarity actions taking place today around the world. So, Abed, I want you to know that your voice is being heard and it is being multiplied by the people who are here and the people with whom we work in our different countries and regions of the world. So we are with you. Now, I wonder if there are any other questions. We've gone over time and we said we would keep on for 15 minutes more. So if there are people who want to have a question or want to make a statement, you're welcome to do so, because this is supposed to be a dialogue.
One note I would like to convey, if possible, please.
Please, go ahead.
In the last few days, there were a high level of rage and anger in Palestine and in the aid sector and relief sector, health sector, about the role of the UN organizations like UNRWA and UNICEF and UNDP. In fact, I have an opinion about this anger, this Palestinian anger about these organizations. I think this was because all of these organizations were ordered to leave the north of Gaza Strip and the Gaza City to the south. That's Rafah and Khan Yunis, the two cities in the south of the Gaza Strip. These organizations have workers in aid and relief and medical support, which work along the other health organizations in Gaza. Some voices were raised about abandoning the duty of these organizations. My opinion is the whole system of the UN has failed in its mandate. We know that many of these workers in these organizations are Palestinians and Gazans, and they really genuinely want to commit to their roles, but unfortunately, the system of the United Nations is failing. They couldn't even protect their own employees. For example, more than 35 health workers in UNRWA were killed. Some numbers mention double of that figure. So the United Nations, with all its components, has failed in keeping the red lines, which we always knew in cases of war and military conflict. For example, hospitals were always exempted from military aggression, which is not happening now, according to international law and Geneva Convention. So claiming that victims in Gaza are collateral damage is nonsense. all targets in Gaza Strip are civilian targets. There is no victory over the resistance, the military resistance in Gaza. So I believe that the Security Council is directly responsible about this failure in the United Nations. Even Guterres, the General Secretary, was intellectually terrorized and was accused of anti-Semitism. So all voices in Europe are being subjected to this intellectual terrorism. Politicians, artists are paying high prices for their stance with Palestine, but we can only hope that this war will reveal the ugly face of the occupation, the shameful support from the United States to Israel. We are paying the blood price for what's happening now, and we only hope that this war would stop as soon as possible, so we will have some chance to remedy the wounds of people and to stop the mentality of collective punishment, which is happening on Gaza Strip.
Thank you, Abel. I would like to call on Melania from Australia, so she can talk about what happened today in Cape Town. Could you put her up, Deepa?
Yes.
Melanie.
Melanie, you should be able to talk now.
Thank you, Hani. I didn't know about that, and we really need to do something about that in the United States. You have a lot of contacts. I want to say it's really time for us to close, and I'm grateful to our interpreters who are so important to us in moments like this. I also want to say that we have 2 other events planned. We are going to have a webinar in the Spanish language on next Saturday, and the following Saturday, that's the 18th, and the following Saturday, Delenn and Fran are working on a plan for having an Asian meeting. This way, we're able to cover different regions of the world that's difficult to do in one webinar. So I want to say thank you, Abed. Thank you. You have no idea how you make me feel. This is so hard. Okay. Go ahead. Go ahead.
Yes, I would like to add one additional point. In the same context, there are more than 100 Israeli doctors who signed a petition asking their government, the occupation government of Israel, to stop bombing hospitals. So this petition is known.
Okay. Thank you, Abed. Okay, I really have to finish up now.
Shukran.
Who wants to speak? I really have to finish up now, but I want to thank everybody who
I know that the situation is very, very difficult in Palestine, but in these meetings, we have always, we like to have somebody from Palestine with us, and I would like to express my solidarity to you. There are many who can't assist with us, any companion who can participate with us in our meeting, we would be very grateful. Great. Thank you so much, Hani.
Okay. Okay, thank you. Goodbye now, everybody. Take care and forward with your solidarity for Palestine. Thank you.
Bye, everybody.
Bye, everyone.
Thanks. Bye.